Portion of Utah's Morning News is brought to you by Regence Blue Cross Blue Shield.
And joining us live in studio is Dr. Mark Hiatt, Executive Medical Director of Regence Blue Cross Blue Shield of Utah. We enjoy talking with you every week, Dr. Hiatt. This is a topic that I know people will be interested in. Relief from depression without prescription drugs. Some people with depression find relief without prescription drugs. So what are some of the methods that they use?
You know, Amanda, there are a lot of methods. And, of course, this is for some people. A lot of people really need prescription medication for this very serious ailment.
Yes, certainly, yes.
But there are some who are able to find relief without the medications. And one of the most studied therapies is actually physical activity. It's thought that exercise is able to lift mood in part by increasing certain neurotransmitters.
Wow, which could potentially take the place of medications.
It does help some people. Other people find relief from certain types of behavioral therapy. That is, if you can train your mind to focus on positive thought patterns as opposed to negative ones, you're actually able to find relief from your depression.
And I know one thing I really enjoy is mindfulness and meditation.
And that's yet another technique, Kent, that some people through mindfulness practices like gentle yoga and daily meditation, they're able to take their thoughts away from the negative and refocus on the positive.
I want to change topics and ask you about this because I just can't believe it. So cleaning your ears, I don't tell me I'm not allowed to do this because I'm going to have a really hard time with it. I'm not allowed to take one of those Qtips and clean my ears?
No, in fact, if you were to read the package of the most famous brand, of course, of cotton swabs, Qtips, they actually instruct you quite explicitly to not use those tips in the inner ear, but only in the outer ear. And the reason for this is that actually the earwax has a protective purpose. It's actually helpful. Earwax or cerumen serves a protective function in actually keeping dirt and debris and dust and small insects out of your ear.
Oh, it's so hard, though, not to.
Yeah, but ew.
Oh.
Okay, but if it's important, and so I won't clean my children's either, only the outer part,
just the outer
never
part.
Into the inner part.
Never into the canal.
All right.
All right, and let's shift gears real quickly here and talk about your smile, right? New study says there are 3 distinct types of smiles?
That's right. There's 3 distinct types of smiles. Smiles of reward, affiliation, and dominance.
So what is a reward smile?
So a reward smile, Amanda, is the kind of smile you would use with a baby. So he or she will smile back or do things that you like.
Oh, like good boy, good boy. So what is what do you say, an affiliative smile?
Yes,
what's that?
An affiliative smile is used to communicate tolerance, acknowledgement of a bond, or really to show to another that we're not a threat.
Okay.
But then there's also a dominant smile.
Yes, that's used to signify status and manage social hierarchies.
So what's the difference?
Well, the difference is thought that over time, these facial expressions have evolved to really help us interact in social groups. So, for example, we need to be able to say on one hand, thanks, I like this, or we need to say, don't worry, don't fear me, or we need to say, hey, I'm in charge here. And we do that through our facial features.
What about a person like me who's smiling all the time?
You could be sending a confusing message.
No doubt.
She's
It's
always
good to
happy.
see. Thank you, Doctor.
Dr. Hiatt, thank you so much.
This portion of Utah's Morning News brought to you by Regence Blue Cross Blue Shield.